health care bill requiring congressmen and their staff to enroll in any new government health plan that they pass. I have to tell you, not a day goes by I don't get emails asking for something exactly like this. So let's take this a step further. Joining us, Republican Congressman John Fleming from Louisiana. Congressman, thank you so much for joining us.
Good morning, Stuart.
Have I got this right? You're saying that if the Congress passes any kind of health reform plan, Congress people and their staff have got to sign up for it, abandoning the gold-plated plan that you've got already, correct?
Absolutely, Stuart. Members of Congress would have to eat at the same table as the American people.
And how many people? I know you've got a petition out. You've got millions of people who've signed it?
Yeah, actually, we launched this resolution last July, and to date, we've just passed 3 million Americans who've come to the website and signed up for it. Our website is the most frequently hit website among Congress today. And we have over 100 Republican congressmen who backed it, but we don't have yet one single Democrat, although we've reached out to everyone.
You don't have a single Democrat? 100 Republicans, not one Democrat signed on for this?
That is correct, Stuart. And apart from that, we tried to get this as amendments within the bills that passed through the House, and even when it came to the floor as H.R. 3962, and the Democrats blocked it every step of the way.
Now, I described your existing health plan that members of Congress get. I described it as gold-plated.
Yes.
Is it?
Absolutely. It is not beyond what you would see with other corporations such as Microsoft or what members of a union would receive. We do have to pay into it. The government pays 75% of it, but it is a wonderful private health plan. And I wish every American could take part of that. But on the other hand, if we pass restricted government-run health care for the American people, then I think we in Congress should be subject to that as well.
But the kind of gold-plated plan that you now have, that simply could not be extended to all Americans, and we simply cannot afford it. I mean, you're a doctor, I believe. I think
Yes.
you'd agree. You can't afford that for everyone.
And that's the problem, Stuart, with this whole government takeover of health care as it stands, is the one thing that's not being looked at is what the cost drivers are in health care. It's not being dealt with, and not everyone can afford that.
Can I just interrupt you for a second?
Sure.
You talked about this, President Obama's plan. I know we're going to get a different plan this afternoon, but the plan that stands at the moment, you've described that as a government takeover of the health care system. Okay.
Yes.
I want you to explain that, because, look, we've got a vibrant private sector at the moment that covers, I think, 60% of the population, if not 70%. You think that's... Explain it to me. How does that just go away and the government take its place?
Well, first of all, let me explain that a significant percentage of health care is government-run today. And the reason why your private insurance costs are going up is because it's having to subsidize the shortfalls from Medicare, Medicaid, and other government programs. What this bill would do is essentially put all health care under the government control, and you would have unelected bureaucrats making decisions about what your coverage would be, what your price would be, and essentially it would put the insurers out of the free market and would drive many of them out of business entirely.
Doctor, would you just tell me what the website is so that if our viewers want to sign up, add to the millions?
Yes, it is fleming.house.gov, Fleming with one M, Fleming, .house.gov, G-O-V. And if you have trouble getting on, just be patient. We are trying to improve the website and allow more people to come to it.
Congressman Fleming, we would love to crash the website with an outpouring of petition signers. We'll see what happens.
Great.
Congressman, thanks for joining us. We appreciate it.
Thank you, Stuart.